Good afternoon, viewers. My name is Meng Febonayog, BSN2 student from Mati Doctors College. And for today's video, I'm going to discuss about those following: the newborn scare, Leopard's maneuver, perineal care, and the urinary catheterization for male and female. And, and first is the newborn care. Newborn care. All newborns require essential newborn care to minimize the risk of illness and maximize their growth and development. Warmth, normal breathing, mother's milk, and prevention of infection are also basic needs of normal baby at birth. And indications for positive pressure ventilation administered either via bag and mask or either via endotracheal tube include: first is an insufficient respiratory pattern manifested by gasping and or an apnea. Second is a heart rate that remains below 100 beats per minute for 30 seconds. And the lastly is the persistent central cyanosis despite administration of 100% oxygen. The newborn's complications are the birth defects, birth injuries, breathing problems, drug addiction, failure to thrive, jaundice, low birth weight, low blood sugar, and the medical problems. These medical problems also such as the digestive system, heart, lungs, urinary tract, and other major organ system. The neurological problems such as the cerebral palsy, developmental delay, dystonia, seizures, spasticity, other movement disorders, nutritional problems, and the premature birth. And the second is the Leopold's maneuver. Leopold's maneuver is the maneuvers are important because they help determine the position of lie of the fetus, which is conjunction with correct assessment of the shape of the maternal pelvis can indicate whether the delivery is going to be complicated or whether a cesarean section is necessary. The indication of Leopold's maneuvers are used to palpate the gravid uterus systematically. This method is abdominal palpation is of low cost, easy to perform, and non-invasive. It is used to determine the position, presentation, and engagement of the fetus in utero. The complication of the Leopold's maneuver is the head is felt in the uterine pole and the breech in the pelvic cavity. The fetal heart tones are auscultate higher than anticipated with a vertex presentation. In the transverse lie and palpation, neither the head nor the buttocks can be palpitate in the lower uterine pole inlet, and the fetal head can be felt in the flank. And the third one is the perineal perineal care. The importance of perineal care is proper perineal care allows for inspection of the skin. It keeps the perineal area clean and less likely to break down. It also decreases the risk for urinary tract infections. The indications of this is the perineal care is needed mostly for those who are bedridden and dealing with incontinence or who have an indwelling catheter. It is important to wash this area properly as doing so allows you to deter the breakdown of sensitive skin. The complication is the common postpartum perineal issues include pain control, hygiene prevention of constipation, and resumption of sexual activity. Clinicians should be able to evaluate less common symptoms, such as severe pain, bulge or mass, or abnormal discharge, including fecal leakage. And lastly is the urinary catheterization for male and female. The importance of urinary catheterization is urethral catheterization is a routine medical procedure that facilitates direct drainage of the urinary bladder. It may be also used for diagnostic purposes or to help determine the etiology of various genitourinary conditions, or therapeutically, or to relieve urinary retention, instill medication, or provide irrigation. The indication of this is the therapeutic indications include the acute urinary retention or benign prostatic hypertrophy, blood clots. Second is the chronic obstruction that causes hydronephrosis. The initiation of continuous bladder irrigation. Intermittent decompression for neurogenic bladder. Hygienic care of bedridden patients. The possible complications of this urinary catheterization are the allergy or sensitivity to latex, bladder stones or bladder stenosis, blood infections or septicemia, blood in the urine or the hematuria, kidney damage, or usually only with long-term and willing catheter use, urethral injury, urinary tract or kidney infections. And the last is the bladder cancer or only after long-term and willing catheter. And that's all. Thank you.